and you're welcome to speak any one of those languages. In order to access the simultaneous interpretation function, click the icon of the globe on your screen, or click three dots and then the button called Language Interpretation on your mobile device, and then the confirmation button. Two important reminders from our interpretation team. Interpreters can hear every microphone on every channel, and it's very important to keep your microphones muted if you're not speaking. And secondly, nobody should be speaking into interpretation off channel. Please speak English only into the English channel, French only into the French channel, etc. This meeting is also going to be recorded. If you have any technical questions, please contact me in the chat. I'm going to paste the explanation of what I have just said into the chat in all our working languages. And with that, I'm handing over to Brian to start when you're ready. Thank you.
Thank you very much, Cyril. I'm going to start recording to the cloud. Okay, very good. And I'm going to share my screen and we'll just get started shortly. Sorry, the screen didn't come up. Let me try again. There we go. Welcome, colleagues, to Global Coalition to Address Synthetic Drug Threats. This is a special meeting for Working Group 2, Detecting Emerging Threats and Patterns. I have a few administrative announcements, and then we will get started. First, want to thank and congratulate you all for your work over the past months. We now have 1,500 plus participants in the coalition, representing 149 countries. We have had 70 hours of sub-working group meetings, and we'll be discussing some of those today. The goal of today's session is to look at the progress that's been made over the past 6 months since the last working group meeting, which was in September of last year. Then we're going to review the draft recommendations. We will also invite comments from the colleagues on the line before the recommendations are posted on the website. If we do not finish the recommendations for today, no worries, we can continue them in April, and that could be the first item of our next session in April. But if we can conclude them today, we will post them on the website without the draft label on them. Now, governments do not need to adopt all recommendations, and they can also implement other recommendations beyond the ones that are discussed here today. So I wanted to also highlight that. If additional discussion time is needed, as I mentioned, we can continue in April. The implementation of the initiatives also begins in April, so please continue to visit the website to identify those initiatives of interest. How do we do that? Well, as you can see on our website, globalcoalition.us, if you click on the Initiatives tab, you will get a list of close to 120 items, and from there you will find projects or initiatives or activities, actions that are maybe of interest. You can then click on them and read descriptions and backgrounds, and at the very end, you will see the contact information from the international organization partner. Please click on that and contact them and let them know that you are interested in adding to these yourself to these initiatives, and then they will connect with you directly and pursue those into the future. That will be one way to connect at the international level through international organizations and partners. But if you have your own initiatives that you would like to promote at national levels in support of the recommendations, we will also be reaching out to you to be able to capture that as well. That's all I have for today. Now I would like to turn it over to our co-chairs, and first also to thank one of our co-chairs in particular, Simone Picchini from Istituto Superiore di Sanità in Italy, for hosting the entire working group 2, both East and West groups in Italy, in Rome, at her center last month. I'm very grateful for that, Simone. Thank you so much. And also to our co-chair, Grant Baldwin, as well. So I'll turn it over to Simona and Grant. Thank you so much.
Grant, please.
Good morning, good afternoon, good evening, everybody. Great to be part of this conversation. Thank you also to Dr. Picchini for hosting us last month in Rome and getting the entire working group and the sub-working group chairs together. I think we've had an incredibly robust set of conversations and discussions as we looked at detecting emerging drug threats and use patterns. We bifurcated our work into 2 specific areas, and those are, and you'll hear from the sub-working groups, those are focused on data collection, analysis, and trends, including early warning. I frame that in my own mind as sort of data. And then the second working group is information, interagency collaboration, and policy formulation, which and we do some of this work here domestically in the United States as action. So how do we collect data that identifies emerging drug threats? And then ultimately, how do we share that information to inform actions in countries across the globe? At the meeting that Brian referenced earlier in Italy, we talked about how we get more timely, comprehensive, accurate, localized, linked, actionable, and ultimately comparable data across countries to tell the story of the changing nature of the emerging drug threats across the country, and to provide across the globe and provide opportunities to share that information to inform government actions in country. So really excited to have the sub-working group co-chairs share with you aspects of the discussion and the draft recommendations that we've put together. I think they're incredibly robust and thoughtful, obviously eager to get your input into those and iterate on them in ways that make sense to the global coalition. Dr. Bocchini, let me turn it over to you to add any additional insights before we go to the sub-working group co-chairs. You're on mute.
Yeah, thank you, Grant. Some brief additional comments I wrote, English is not my first language. Yes. After the meeting in Rome, I think that the word we have to use for this working group for the data collection, information sharing, interagency collaboration is harmonization. Because during this month, as the co-chair of sub-working group will show us, we learned that we have a bunch of data regarding, as I told many times to Brian and Sarah, and thanks to them, data on substances, consumers, and trafficking. So 3 sorts of data that we have to harmonize all over the world. In the places where there are many facilities and we have all the data organized, also in places where we don't have these facilities. So what I wrote is that we should reach and help those parts of the world with greater difficulties in detecting emerging drug threats and provide them with tools and knowledge and empower them with specific training. So I repeat once again, my key word is harmonization of data, platforms, and analysis. And I hope that Europe, America, North America, South America, Asia, Africa, some representative can meet together to try to harmonize and to go maybe to let everything simpler but very similar so that our data can be superimposable and we can really understand the emerging drug threats in different parts of the world. So thank you very much. And I give the floor to the co-chair of sub-working groups. Thank you. Thank you, everybody.
Thank you so much, Simona. I think Charles is there as well. So for sub-working group 2.1, actually, I'm Benoit Chambaud from Canada, Montreal, Canada. And Charles is there as well from South Africa. Because sub-working 2.1 likes to do things differently, we come up with our own PowerPoint slides, so just a little bit different. So so actually we're gonna spend, I guess, more time on the recommendation, but just before we go there, very quickly, we're gonna talk about the purpose of that 2.1 sub-working group and just an overview of the presentation we have seen so far. So if we can go to the next slide. So the purpose, I think you can all read it, and Brian mentioned about it just before.
Okay, all right, let me carry on then. Benoit and I are going to team present this. So good morning, good evening, good afternoon, wherever you are. I'm Charles Perry. I'm co-chairing the sub-working group with Benoit, and we've had 12 presentations between October last year and and February this year, and you can see them listed there, sometimes 2 or 3 on a given day. We have covered a lot of ground, a lot of presentations from colleagues at UNODC, EMCDDA, World Health Organization, myself, colleagues from Canada, and so forth. So we've had a lot of presentations and we've had some discussions. Various issues emerged before I go on to the recommendations. Sorry, I've got this in the way here. We discussed what, certain priorities. What are we going to focus on? Focusing on the consequences. Are we looking at emerging NPS? Do we need real-time information or historical? I think the best would be to have as up-to-date as possible. Where is our focus? Are we looking at production, trafficking, use, harms? There are data issues that came to the fore, and Simona mentioned that some areas have a struggle more geographically to have data. How do we improve data collection, quality, capacity building? She referred to that as well. We also touched on the importance of data visualization tools, and some of these presentations showed us what can be done with good graphics. Other issues to discuss were mentioned. You can see those below. And before we move on to the recommendations, various ideas came forward for development, some principles, the importance of triangulating data, the harmonization issues that Simona mentioned. We need to leverage expertise. There are certain parts of the world where there are more advanced, certain institutions have greater capacity. We need to build on that. We need to look at new methods, including AI. We should try to encourage people to come on board, a carrot approach rather than a stick approach. And we need to follow small wins, showing successes and building the quality of data over time. So over to Benoit with recommendation 1.
Yeah, so that's the first recommendation we came with. Actually, like Simona and Grant mentioned, we had a very good discussion last month in Roma. So a lot of idea was shared. So the first one was regarding the forensic side of it, and you'll see the other recommendation is from other topic, but the first one is forensic. So improve information on drug composition, origin of the substance, pattern of use, and harm, actually, for sure. So there's kind of a let's say sub items in that big recommendation, but maybe developing a global forensic network, supporting the development of a regional intelligent network of forensic laboratories, epidemiologists, researcher, academic, law enforcement department, community, stakeholders, NGOs. So a lot of different people from different expertise, different point of view. And the third sub-bullet, at a national or regional level, supporting forensic analysis capacity by providing laboratory equipment, forensic laboratory equipment, guidance and methods, technical assistance, sharing reference standards, supporting laboratory accreditation. So everything that we could do as a group to help to harmonize, I think that's the word of the day, to harmonize the data collection in the different type of subset. So depending on what you're looking for. So that's in a nutshell the recommendation number 1. So I know we don't have a lot of time, so maybe let's go to the number 2.
Yeah, so you can see that one focusing on building a network and building capacity at different levels. And that's carried through to the next recommendation, which is on epidemiology networks. Recommendation 2 is to facilitate and institutionalize sustainable and recurring data collection, analysis, and reporting systems through the establishment of national drug observatories and regional epidemiology networks with the purpose of strengthening early warning systems and international data collection and dissemination platforms. And we gave some examples of regional epidemiology networks, the UN Annual Reports Questionnaire, the UN Drug Monitoring Platform, the Early Warning System from the WHO, Tox Portal, and so forth. So that's the second recommendation. And the third one is looking at innovation. Recommendation 3, to introduce and expand innovation of drug data collection techniques. This is a methodological focus, such as wastewater analysis, AI data collection tools, rapid situation assessments, web-based clinical screening tools, access to data visualization through training and technical assistance to provide greater clarity and precision with respect to drug use and trafficking. So what we're talking here in the two recommendations that I've spoken to relates to building the networks, building capacity, improving data collection and reporting. And that was fairly similar also to the first recommendation. And that's it for us.
Yeah, so that's it for us. So I think based on the agenda, we have probably around 10 minutes for a discussion, questions. So people from the floor may have some questions. So up to you. Maybe we can start with maybe quickly Simona or Grant, or we want to go with one of the 192 participants on that call.
Yeah, I think I'd love to hear from one of the other 192 participants on the call, but just wanted to express again appreciation to Charles, you and Benoit for your leadership. I think just to summarize, they've done an incredibly nice job of sort of putting together recommendations across the forensics, epi, and innovation with a focus on networking and harmonization, and an emphasis on looking for ways that, depending upon where countries are, they can plug in to this in ways that make sense to them. So would love to get feedback to Charles and Benoit to inform our continued efforts. Mariano?
Bueno, muchas gracias por la presentación. Creo que el tener
Thank you
información.
very much for your presentation. I think having information is so important. Today, based on UN information, we only have 97 out of the 193 countries. We have information from them, meaning half of the countries around the world. These are the countries we have information for. The rest of us are flying blind. We're acting blindly. And I think that this is a serious problem. It's a serious problem that the other half of the world does not have information that they need to understand what is happening when it comes to any of these substances, and especially not countries that have bias studies. There are only 40 countries that have over 4 or 5 studies that have been conducted to look at trends and to see what is happening when it comes to substance use and what substances have been evolving, where there are upward trends which are stabilizing and where there are downward trends. I think this is very urgent. I think that working blindly, it makes things very difficult. I'm a psychiatrist and I run Plan Colombo in the Chilean office for Latin America and the Caribbean. And as a doctor, the diagnosis is so crucial when it comes to then deciding treatment. And if we do not have good diagnoses, good information about what is happening, then working on a complicated phenomenon and doing this blindly where we don't have information, we don't know if we're doing things right. We don't know if we're having a good impact on this phenomenon. And I would actively promote studies in every country and studies conducted over time. Thank you very much.
Charles and Benoit, do you want to respond to that, or we can go on to
I can come in quickly. I think what Mariano has said is probably the most important thing that we need to hear. We still got to hear other people ask questions, but building capacity and getting involvement, supporting data collection in parts of the world where there is not good data. I think that is crucial, and how we do that's going to take a lot of thought. We did talk in Rome about building upon things that have happened in the past, like the UN had the global assessment program. So there are guidelines which can help countries to build a data collection system if they don't have it. It may require, I think, a lot of support encouragement, facilitation. Certainly, that's what happened in my own country when we got things going in '95. We had support from the US State Department to set up our surveillance system. So supporting countries, modeling, showing what can be done, providing capacity, even if it's at a regional level, that will be crucial. So yeah, he's spot on in terms of meeting the gaps that exist in certain part of the world and helping those countries to move forward. If we can make progress in that area, I think we would have made a big contribution. Thank you.
Thank you, Charles. Yeah, we talked a lot about sort of how we can port what's being done in high income countries to low and middle income countries in ways that is achievable in those jurisdictions. And frankly, as you said, build on some of the lessons that other countries have learned in standing up their systems. First Jenny, and then my co-chair Simona. Jenny.
Buenos días para todos. Muchísimas gracias.
Good morning, everybody. Thank you very much for the presentations and the recommendations. I think that generally speaking, the recommendations look good. I just would like to stress one of the aspects that is included in recommendation 9 with respect to early warning systems, and stress the importance of low-income countries also having early warning systems, as was mentioned just now. This is something that is currently happening with more developed countries, and that creates a gap with countries that have fewer resources, fewer capabilities, specifically with forensic analysis, since this is what the backbone of early warning systems. Also, with respect to recommendation 11, naloxone, this is a great step forward, but we think that it is necessary to include and make clear that naloxone should be made available in the community, not strictly among hospitals or the healthcare system. In settings where there is a doctor and a nurse, it should be made available where people consuming psychoactive substances are, to allow for faster response to save lives. Other points that that we looked at in recommendation 13, but also something that came up in others, was forensic laboratories for purposes of chemical analysis and substance identification. I think that's a very important point that countries should strengthen. This came up in a lot of meetings, and that is that there should be analysis carried out beyond just seized samples. We should also be analyzing biological drugs and also samples received from health services. If people come into a health facility having a health issue because of drug consumption or samples taken from deceased individuals for purposes of better compiling information to inform decision-making. A lot of things are happening, and because of a lack of strong information or detection system, we're not able to truly understand the dimension of the country problems that we may be facing in our countries. Thank you very much.
Thank you for those insightful comments. Simona?
Yes. Sorry. Answering to all of you, but also especially answering to Jenny. So I asked to speak in Spanish, and I asked the translator to translate me in English.
Please go ahead and speak in Spanish, but make sure that you speak into the Spanish channel, please.
I don't know how to do this.
You need to
I'll
click
speak
the icon
English.
of the
Don't
globe.
worry, don't worry, don't worry. I will speak
Okay.
English in any case.
Thank you so much.
Very slowly. So, Jenny, probably naloxone, it's more devoted to the first working group, not to the second. But in any case, it is a very important point, the distribution of naloxone. Regarding the implementation of drug detection in countries with less capacity. I think my suggestion to Brian, to Sarah, to Global Coalition in general is to create a group of experts trying to detect which are the countries with more needs to implement forensics, epidemiology, data collection, and when having detected them, create, like a task force to see which kind of implementation can be done. For example, I remember that Charles Parry suggested some time ago in one of the first meeting that maybe in a very big country, we can create one lab or two labs, like in the philosophy of anti-doping labs, in which all the samples can be collected. And first of all, I think that the simplest sample is waste water. Before, biological samples or seizure samples. But seizure sample and wastewater are easy to collect, are easy to store. Maybe it's complicated to ship them, but for this reason, a task force can operate to establish this situation. And that's what I think we should do regarding data collection and in forensic and epidemiology fields, creating a task force to focus on the most needed countries where it is important to implement, and also countries, it's time to ask. It's time to ask and to write down necessities so that all of us can know what a country can necessitate. I have to mention that, for example, after these meetings, Croatia asked Italy to come and visit our labs, our early warning system, in order to implement their early warning system. We are in Europe, we are a small region with respect to America, but this interchange between countries can be a first start, but everything has to be, put inside a protocol, a precise protocol in which actions are to be reported. Thank you.
Thank you, Simona. I think we've talked a lot about how we can do some of that best practice information sharing and meeting countries where we are. I don't think any of us would be on this call if we didn't want to harbor and support that exchange, including some of the hard lessons that we've all learned in doing our own emerging drug threat assessments. Miriam, you had your hand up for a minute and then it's gone down. I don't know if your question was addressed already, but I did want to make sure you had a chance to voice your input.
Sí.
Please go ahead.
Buenos días, yo no sé hablar inglés.
Good morning. I don't speak English or Spanish. Sorry, I don't speak English, but can you hear me?
Yes, please go ahead.
Sí, bueno, yo I no speak English, speak Spanish. Creo que este tipo de actividades que nos
I
unen.
think that these types of global activities require us to consider synthetic drugs as an issue. And I'm from Ecuador, and I think among all of the topics that you've brought up, including what Mariano mentioned from Chile, an important point is that we need better epidemiological data on a worldwide level. But I think that it's important to have established capacities and looking at the strength of institutions in every country. In some countries, we don't have strong institutions, and our organizations operate within other organizations, and we're not able to implement public policy as far as supply and demand. And so that's a key element for strengthening all of the processes that we're discussing. In terms of what we're doing, and also consider each country's experience. Oftentimes, budgets don't exist even for training or the implementation of processes that allow us to continue to implement policies based on differential quantitative and qualitative diagnoses. I think the coalition's global focus is important, and I think that prevention is synonymous with integration, and it was a pleasure for me to take part in this call. And I also call on you to think of countries that don't have certain institutional strength. Every country has its issues, their particular realities as within the context of these social issues. And as far as early warnings and forensic diagnoses, we have to recognize that the countries face different and varied realities within the context of the socioeconomic dimensions of drugs. I also think that as we work on anything to do with supply and demand, we should look for community solutions, specifically for the first and second quintiles in terms of the community and our neediest populations who are struggling to meet their basic needs, and specifically addressing them. Thank you.
Thank you so much for your comments. We talked a lot, Miriam, in Rome about the importance of global development, sort of underscored the importance of recognizing the diversity of resources that exist in country to sort of to identify these emerging drug threats, and then sort of as importantly to act on those threats. One of the sort of critical questions that was asked of me when we were together in Rome, because as many of you may know, we have a fairly significant fentanyl problem in the United States. And countries that were there reached out to me and said, hey, what would you do differently now? Or what would you tell us if fentanyl, comes to our shores? And I think it's critical, once we've identified these emerging drug threats, to share best practices on what countries are doing when new threats are in country. And I think maybe that's working group 3 as well, but critically important to address that. Brian and Sarah, I'm looking down at the agenda provided to me. It looks like we need to move on to subworking group 2.2, but I don't want to curtail the conversation, but maybe we could go to subworking group 2.2 at this point.
That's right. And I will begin the recording, and we can have our co-chairs present. Thank you.
Bueno, gracias, Brian. Un saludo muy especial para todos.
Thank you, Brian, and cordial greetings to everybody. It's a pleasure to share these points with you in this Global Coalition meeting on synthetic drugs. My name is Jenny Fagwa from Colombia, co-leader of Group 2.2 on interinstitutional communication with respect to drug policy. I'm coming to you from Colombia with my colleague Diego Sanchez, and I will also offer greetings to our colleague Claire. Okay, so I will carry on to keep moving forward since our time is limited. So as you know, according to the agenda's methodology, our goal with respect to this point is for co-chairs to offer a summary of this subgroup 2.2's work, which I will do in 5 minutes. And then our colleague Claire will present this subgroup's list of recommendations, likewise in the span of 5 minutes. And so this is going to be something very brief. It will be very much a summary of what has been discussed in these meetings. And we would also like to very briefly note, as an aside, is we would like to join in Brian's comments at the beginning with respect to the meeting that was held in Italy with Simona. Unfortunately, those of us from Colombia were not able to join, but this has been a very fruitful space, or that was a very fruitful opportunity to advance this group's objectives. So subgroup 2.2 discussed a variety of topics with experts, very similar to 2.1. These are interrelated topics. Oftentimes it's hard to differentiate what one group is going to cover with respect to the other. But as you all know, within this group, we've already had the opportunity to meet starting about 6 months ago. We've had 4 meetings to exchange experiences and best practices. We consistently have over 100 people in the meetings from about 90 countries. And what has emerged from these meetings, starting in November 23, we had a meeting from the African Network Against Drugs discussing how they're able to work among the member states and how they're able to share information about drug treatment, drug use, drug sales. And we also had a presentation about the strengthening national drug observatories, which underlines the importance of evidence and information, data systems, and the findings that come from that then help to define policy decisions with respect to drugs. In our December meeting, we were able to learn more about programming and the Committee on Experts in Drug Trends. They're able to explain their process on including a new substance on their lists. This is something that has been amply documented, and they encouraged evidence-based recommendations. We also heard a presentation about information exchange and the tools that the UN has in that regard, specifically with respect to international cooperation among laboratories and national systems. This has to do with our goal of improving the performance of laboratories. And within that, we discussed international cooperation with respect to drug analysis, an effort in which 400 labs from close to 110 countries participate. Representatives from the UN shared their toolkit, their standards, and the options that they have for strengthening the performance of forensic labs globally.
In the January 2024 meeting, we saw from our colleagues in Australia the significant developments they had in terms of this innovating technology with wastewater analysis to detect substances, including new substances, by analyzing wastewater samples. And through sample identification, we can make estimates in terms of the supply and demand of psychoactive substances. This is done through a very well working system that enables us to have input for policymaking. Then during our February meeting, we were able to become familiar with some UN tools for data exploration. The United Nations also provided us with a virtual training initiative, which is a very important tool for decision makers, because all of the content of this training focuses on how to develop good, sound evidence-based drug-related policies tailored to the national and regional context for each of the countries in the world. And then we also had a presentation on developing an international network for legislation on illicit drugs, INLID, which is very important for us countries to better craft a response to the threat of synthetic drugs and to see how we can better strengthen our legal systems, our regulatory and policy framework, so we can do seizures, we can prosecute and have a better judicial response to the trafficking in synthetic drugs. So in general, this is a summary of our meetings. And now in the different presentations, we will see a more breakdown of what we did. Everything is evidence-based, it's based on sound data, information, etc. And we're also going to talk about information sharing as well as interagency cooperation to supplement what subgroup 2.1 did that has to do with data generation per se. Well, this concludes my portion, and I will now give the floor to my colleague, Claire.
Many thanks, Jenny, and it has been great to be working with you. And I think that's captured the richness of our discussions over the last few months and all that we have learned. Yeah, I would also echo thanks of many to Simona and for hosting us in Rome. It was a really helpful meeting and I think moved us forward. Okay, Sarah, if we can move to the next slide, and I'll talk through the emerging recommendations from group 2.2. So the first is recommendation 14, develop, resource, assess, implement, monitor and evaluate national drug strategies and synthetic drug action plans through support from international and regional organizations upon request and in accordance with national legislation and regulations. So I think a key theme of many of our conversations has been around actionable insight. It's something that Grant mentioned as well. We want all of this data and information to ultimately inform responses that affect and intervene in the emerging situation. And I think through our conversations, we have seen the value of understanding others' strategies and drug action plans and beginning to assess our own against those. We saw particular value in thinking through specific case studies. This came up in the conversations in Rome as well, looking at the chronologies of how an incident can escalate and understanding, when are the optimal intervention points. So this recommendation, I think, really will bring together an opportunity for multiple countries to look at the plan through the lens of each other's. The next recommendation 15 is to develop an international network for legislation on drugs, INLOD, to support the development and review of legislative, administrative and policy initiatives and adoption by legislative and executive bodies. So I think something that has come out of all of the conversations across the group 2 sub-working groups is the importance of networks. And I think in this one in particular for legislators, we're thinking that there will be a space to share learning, but also to think tactically and politically about how best we escalate this to senior decision makers, those in positions of influence, to make sure that things are translated into legislative and political action. We'll move on to the next slide. So 16, to assess rapidly evolving regional synthetic drug challenges by holding frequent recurring meetings of regional partners, intelligence and analysts and other networks to develop regional responses through dialogue, policy adoption, coordinated actions, data sharing and program implementation. So I think where the first two recommendations perhaps focus more on policy formulation, these two are more around information sharing. And I feel like interagency collaboration underpins all four. Recommendation 16 is fairly self-explanatory, but making sure we do have the right forums to interpret, I suppose, the information as well as to share it. We talked a lot in Rome as well about the value of analysis. There was a wonderful phrase about it's not enough to make the data speak, we have to make the data sing, from Angela May, which really struck me. And I think it's by getting together that we do lots of that intelligent analysis. And then the final one, 17, establish protocols and promote the use of existing global platforms for rapid exchange of information related to cross-border threats upon request and in accordance with national legislation and regulations. This to me feels critical. I think we are also acutely aware that this is not a challenge that respects borders, and we do need to make sure we have the right structures in place to have really timely information sharing that is not hampered by kind of unnecessary burdensome processes, but that can really inform response and help us to form collective action. Okay, I will pause there, and I think we will open up for questions and reflections from the group. Jenny, is there anything you would have liked to add on the recommendations first? Okay, and Grant, Simona, if...
No, thank you so much for a wonderful summary of sub-working groups activities. I'm sure there are questions for Jenny and Claire or comments.
Thank you, Claire. Before I forgot to say something to Brian and Sarah first and to everybody. Last week, we had a meeting with the European Monitoring Center for Drugs and Drug Addiction, and Michael Evans-Brown, I don't know if he's now here with us, told us that we have to intercept drug threats at the beginning, in the rising curve, not at the top, not when the curve is going down. And for this, we have to speed information sharing is strongly required, and organization, because when a phenomenon is rising in any part of the world, we have to go there and run, as we can with the information to inform. This is the early warning. We have to be really early warning. So now it's time to speed all what we put in place so that it can be useful for us, because the problem is detecting a rising phenomenon, not an established phenomenon, an established threat. Thank you.
I have paused the recording now so we can start the discussion phase. Thank you, Simona. Any questions or comments or thoughts from the group on the recommendations? We have about 8-9 minutes left in the session. Bill.
Thank you, Brian, and thank the co-chairs and the sub-working group co-chairs. Just briefly to kick off the discussion, it seems like this area would be one that would benefit a lot from best practices in how to achieve this kind of better coordination and use of data. That's all I wanted to say to kind of see what sort of reaction you all had. Thank you.
And Before Ben, we go to you, I would say just to react, Bill, to your insight. I mean, I think one of the things to also reflect on, certainly true here in the United States, is that our ability to use those data to drive actions is certainly driven by receptivity to policy actions at the sub-country level. So certain US states have a more willingness to take on actions, while that same diversity of perspectives and willingness to take on evidence-based practices may not exist elsewhere. I suspect it does at some level. So that's part of the issue for us as well, sort of emerging drug trends driving action, evidence-based action, but doing it in a way that sort of meets localities, or in our case, states where they are. Anne, I wonder, can we go to you next, please? If you're talking and you're on mute.
Yeah, I see Pan Sofia Carreño with her hand up.
And Sophia, you are muted. Pan Sophia, you are muted. Please go ahead and mute and start speaking.
Sí, muy buenos días, buenas tardes a otros.
Yeah, good morning or good afternoon, evening. From Panama, we have been getting ready to coordinate and launch the early warning system. And actually, last week we held meetings for that purpose. And out of everything that we've been discussing over the several weekend meetings we've had, one of the highlights is the need to have better articulation between and among all of the agencies that may be providing data. And that may be kind of hard sometimes. We have been raising awareness among healthcare organizations and forensic labs so that they can better understand the need to share data and to make sure that the data that we receive is not kept to themselves, because that's going to enable us to do a real-time analysis, because we cannot happen after the fact. We need to try to be as close to real-time as possible. And I believe this was a very significant fora to let us highlight the importance of sharing data. So an important part of this awareness raising had to do with everybody that handles significant information can be on the lookout for early warnings to give us a better picture of what's going on. Thank you. Thank you, Sophia, for your comment. And now to react to Sophia's comment, I would also like to highlight the importance of recommendation 17 that Claire mentioned, that is related to regional responses. And we think this is very important because the world of synthetic drugs is very large, and there's a very wide variety of substances, different types and classes, etc. However, at the regional level, there seem to be very specific trends and behaviors. For example, in Colombia and several other Latin American countries, we do not have a major problem with illegal fentanyl use. However, in several countries, and we went over this with a meeting with Tom Brown and SICAR as well, that in some countries like Colombia, there's been an increase in seizure of fentanyl in ampoules. So we have seen that in 5 or 6 countries because these are for medical use. So maybe we could have more specific meetings at the sub-regional level to have a better picture through data analysis and other information to see how this substance is being used or abused, because we have seen an increase in seizures for that substance. However, we don't see use indicators that point to whether or not it's for just regular use, it's for expert. There's like a void of information in that sense. So I'm bringing this up because of what our colleague from Panama just said, in the sense that we need to have more conversations at the regional and sub-regional level. I see that Simona has raised her hand, so go ahead, please. Yes, thank you.
To add a commentary to what Sophia said, I think Sophia is from Panama. Well, in April, two forensics from Panama will come to Italy to learn about early warning system. The flow of early warning system that it is not mandatory, but it's voluntary, and in this and so you cannot force the entities to join a national early warning system. And so the political involvement is very important. So I'd like to ask Brian, what about the political involvement? You told us that at a certain point, all the political entities will be informed regarding these recommendations. Can you inform us a little bit more regarding the political involvement in global action? Thank you.
Thank you so much, Simona. We shared, so as you all know, we had the ministerial meeting in July of last year, and many ministers attended that event. There were points of contact, high-level points of contact to the ministers, policy-level points of contact. We have shared all of the recommendations with them. So they have had access to the recommendations. They were invited to this meeting as well. And following this, we'll maintain that connection. However, I will share that that is a subset of the 149 countries that are now participating in the coalition. So we also rely on all of you colleagues to share with your leadership in your countries these recommendations as well. And we're trying both ways to try to connect with that. We're hoping that at the high-level segment at the CND, there will be further discussion of the coalition and its goals. And then we will also be having working group meetings during the regular session of the CND, where we will invite the colleagues that are there to also participate. Thank you.
Well, I think Brian and Sarah, we're just about at time. Mariano, why don't we give you the last word, and then maybe I can invite Simona to say some final comments as well. Mariano?
Muchas gracias.
Thank you very much. I just wanted to highlight what Jenny said for the region of the Americas and Latin America specifically. I think that the main opioids that we will find that are improperly used will be those that have been diverted. I think in Latin America, we're dealing with a significant access problem to opioid medications, those that are necessary for medical use. But I think there are weak controls when it comes to these resources being diverted and used improperly, specifically fentanyl when it comes to anesthesia, codeine as a cough syrup, and tramadol as well as an analgesic, an opioid that is important. And I think that more than clandestine labs, what we're being affected by mainly is this deviation, and we need to include ministries of health as a serious partner in this conversation to avoid this diversion. I think that will be the main problem for our region, first of all. Now, synthesizing opioids and methamphetamines will also probably be an issue, but what we see most prominently is this issue of diversion, and I think that we need to implement many actions to avoid this so that there is proper use and avoid diversion. These are the main 2 points. Thank you.
Thank you, Mariano. Simona, why don't we give you the final word? I will say to Mariano, we obviously had a lot of experience around first prescription and then illicit opioids challenges in the United States. Happy to have a conversation with you offline. Simona, final word.
Yes, thank you. Saying bye-bye to everybody and see you next time. I want just to ask Mariano that in the comment on what you said in Italy, we recently launched an alert by the Ministry of Health to the hospitals and pharmacies to take care about the fentanyls and fentanyl analogs and synthetic opioids to try to avoid stealing, and so much more control. And this is a national alert launched everywhere. So a national alert is a part of national early warning system that can be implemented. Okay. I close this meeting. I thank all of you. I thank the the two co-chair of the sub-working group. And I thank Brian and Sarah for all the job. And see you next time. See you in April.
Thank you so much. Thank you very much. I will turn it back to Cyril now.
Thank you.